All right, here we go. Okay, I'm going to put speaker view. There we go. Okay, wonderful. So welcome everyone tuning in today. This is I decided to mix things up a little bit. So instead of doing our monthly webinars, this is a 3-part series to really help you all dive deep into trauma and learn a little bit about how it affects, not a little bit, but maybe a lot about how it affects the physical, emotional, and spiritual body and the road to recovery. So tonight we're going to be talking all about that. And if you want to ask any questions, I encourage them, of course, in the chat. You can do that. You can put them straight into the chat, or you can put them in the Q&A section and I'll answer them at the end. Either one. The chat I'll answer as we're going along. And let's see, I want to make sure that I have that up. Okay, great. So let me get it. All right. I think we're all good. Okay. Excellent. So tonight we're talking about, this is the intro to the workshop, and I added everyone, or our team added everyone. There's a special program for all of you for this webinar series. That way you can really have the juicy content. If for some reason you don't have access to that program or you can't find it, it should be in your portal. Just let us know. And I will show you too. Should look like this. This is what you see. So when you log in, this one just opened up at 5 o'clock. So you should see welcome to the Healing Hearts Trauma Workshop. And you'll see here a description. And then there's also, there is a handout at the end and some different things to do. So this is the major handout if you want to download it. And it's going to be pieced through week by week in this month and then the following 2 months after. Okay. Go back and share here. Okay, great. So tonight we're really talking about the introduction to trauma recovery, because that's a big piece about how our body, especially in the chronic disease state, holds physical trauma. And so I would love for you to share, those of you tuning in today, what has really motivated you to attend the webinar tonight on trauma recovery? Anybody out there that's joined in so far? Deanna or Andrea, do you either one of you want to chime in about what has motivated you to join tonight?
I guess for me, I realize that a lot of our health issues actually have some sort of emotional or trauma component to it, more likely than not. And so I just think that it's important to get to the root cause and not ignore that.
I love that. Yes, really you summed that up perfectly, right? Really learning how our emotional trauma and physical trauma affects our healing, right? That's really about what we're talking today. And also, as a way that we can then accelerate our healing when it is recognized. So 2 huge components. Okay, so let's talk about what is trauma first, because I think if we need to define it to kind of see how it plays in our body. So what do you think? How would you define trauma? Let's see. Andrea just chimed in. She says, I'm dealing with the aftermath of some serious concussions that have led me to be tube fed, right? So she's definitely working with some trauma from concussions. And I'd love for you to just throw out there in the chat, how would you define trauma? Or you can also, if you want to chime in the audio, you can too. So, oh, yes. Okay, let's see. So if Deanna wants to know where to find those documents. So when you're in yours looks a little different from mine, but when you're in your patient portal, you should see a program there. Also, it went to your email. You should be able to link to it and open it up. So if you can't find that, let us know. But I will let me drop the PDF for tonight over there so you can at least have it. And if you can't get in, let us know. Let's see. Let's put in. Okay, I just dropped in the chat the guide for tonight. And then we can help you get in if you're not able to find that in your documents or not your documents, sorry, in your patient portal. It should have a program section, I believe. And I'll see if I can find what that looks like. I'll take a screenshot of it for you later and put it into the hub. Okay, you're welcome. Okay, so yes, so defining trauma, I think that's our big piece here. And what words or images come to mind for you when you think of trauma? A significant change in your body. Yes, that's totally a trauma. That is totally trauma, right? This from being in this state of health. And then, so what would be a word that so change, that's a good, change can have its good connotations and its bad connotations. So change, any other words that pop into your minds out there? Trapped energy. Right, exactly. So that's a great one. Or trapped even just by itself, and energy by itself, right? These words where we're thinking about what trauma means in the system. So trauma really is a piece of both emotional and psychological response to a distressing event, right? So some traumatic event that's happened to us, it can be one single event, such as an accident or physical assault or prolonged exposure to something really traumatic, such as, a war or war-torn country experiencing childhood abuse, etc. So trauma can have this significant impact on not only our physical health, but mental health, right? Because that's a huge piece of how we process it. And then it can manifest in so many ways, which we're going to be talking about tonight. Anxiety, depression, of course, PTSD. That's a huge piece of trauma. It's got trauma in the title, post-traumatic stress syndrome, right? Or disorder, as a way for us to help people understand when we're processing this huge trauma piece. So trauma affects so many systems in the body. So one is it really affects the cardiovascular system, leading to change in blood pressure, whether that's elevated. Most of the time it's elevated, but it could be lower blood pressure and increase in heart rate. And that can lead to an increase in cardiovascular disease later down the line. So it also can help, or not help, but it can weaken the immune system. So a big component. So cardiovascular system and the immune system, it makes us more susceptible to infections and illnesses. It's kind of that stress component, right? We see that same thing when we have chronic stress. So trauma can lead also to chronic pain, such as back pain or fibromyalgia, which can then have such a significant impact on your quality of life. And that's a big thing that we're talking about today, is how does trauma impact our quality of life, right? Because we want our quality to be the best it can be. So recovering from trauma can be difficult and a challenging process, but it's totally possible to overcome the effects of trauma and improve your mental, physical, emotional, and spiritual health. But we want to kind of acknowledge, really, and validate the feelings that we're experiencing as a result of this trauma, right? Because this can be the place where we can sometimes have feelings of shame, isolation, right? Because depending on what kind of trauma it is. And it's always important to seek some type of professional help, whether that's through counseling or seeing a practitioner like myself, really helping you to walk through that trauma. And a therapist or counselor can then help you to really process the individualized feelings, develop some coping strategies to help you kind of deal with the stress or the trauma. And then also addressing, of course, any underlying mental issues that could be going on as well, mental health issues, I should say, like anxiety and depression, big ones that can play along with that. So what's the piece then we want to make sure that we're doing in regards to trauma is really crucial, is self-care, right? And that's a big piece of, my philosophy and all of you tuning in, right, is the self-care component. Because we know that when we get enough sleep, we eat healthy diet, have a great nutrition, and we engage in regular physical activity, drink lots of water, have great sleep, right? It's those foundations of health. This is when they're all working in tandem, in flow with me, nutritional coach, professional, right? Mental health professional. When these pieces all start to come together, this is when it's really much easier to deal with trauma. And also a big component is connecting with other like-minded people who are going through a similar experience, right? That's one thing why I created the hub aspect, is for everyone, the patients, to kind of be able to relate to each other, right? Going through similar things, because when we work together with healing, our healing is exponential. So you can work through trauma with here in our support groups, online forums, engaging therapy sessions. You can also use, of course, great self-care techniques like breathing, right? Deep breathing exercises, meditation, yoga. These can really help to decrease the feelings of stress and anxiety. And I'm going to be posting in the program, I'll be posting different meditations and little tips that you can use over the next 3 months, right? It's a long time for us to work through trauma, because trauma is something that usually affects us, and sometimes it's harder to, it can be, I shouldn't say sometimes, it can be harder to work through and so I didn't want to rush it and have like one webinar, here we go. That's why I created a little program for it. And so when we have a plan in place that helps us deal with trauma, right? That helps us in case we have any triggers come up or overwhelming emotions that we need to process. So that's why this space here is very important. And also we created a chat for all of you that are in the program to be able to talk, and people will be watching the webinar later that can't tune in tonight. So of course, chat about that and when you watch the replay. Okay. And the other important aspect of trauma is that we want to think about the healing process. I was just talking about, it doesn't happen overnight, right? It's important to be patient with yourself, to really recognize that trauma affects us in many different ways. And we want it, when we have the right support and the right tools, it's possible to kind of overcome the effects of trauma, or it's very possible to overcome the effects of trauma and improve your well-being. And it's really important to note that not everyone's experience is going to be the same. It's very unique and very different, the root cause of the trauma and the way that you process it, because we all process things very individually. So that means that that road to recovery is going to be different, right? Very individualized. So you want to seek specific help for specific symptoms that might be persisting: physical, emotional, spiritual, mental, whatever kind of that's your MO or what's affecting you the most. Because there's different forms of therapy. As both of you know that are on the call and those tuning in, there's tons of different therapies to help us with all kinds of aspects. So during this module tonight, we're going to be focusing on trauma recovery, and we're going to explore different types of trauma, their effects on the body, and the various treatment options available to those who've experienced trauma. And we're going to discuss how to take care of yourself if you've been through a traumatic experience, or also how you can support a loved one, because that's a big piece, especially how we have the holidays coming up. That's one of the reasons why I made this over the holidays. Okay, the next piece we're going to really talk about is types of trauma. And let's chime in. Let's have you both chime in, and hopefully we'll have some other people joining us soon. Can you name some different types of trauma that people might experience in their lives, and how do you think these types of trauma might impact individuals differently? I'll put that question up there. You can chime in if you'd like on the audio or the video, or you can put it in the chat. There's all kinds of ways. So what do you think here? What are some different types of trauma that people might experience in their lives, and how do we think these types of trauma might impact individuals differently? Crickets. That's okay. It's all good. It's part of processing. It's a big question. And so, when we think about different types of trauma, that's what we're going to be talking about. And I'm going to talk about how trauma makes many different forms in the body, right? And so a person can experience many different types of trauma. And we know that trauma has a huge impact on our mental health. Anxiety and depression, those are huge pieces, as also our physical well-being, like I mentioned. And some of the most common types of trauma, I'm going to share this slide here because this is a really great one I created. So here we have the different types of trauma. So we have acute trauma, complex trauma, developmental trauma, interpersonal trauma, and collective trauma. So lots of different aspects of trauma. I'm going to make that a little bit bigger here. There we go. I think you can see that better. Okay. So acute trauma, this type of trauma is usually a result of a single isolated event, right? And that's pretty well known, right? Like a car accident, natural disaster, physical assault. That's usually hopefully only a one-time event, and you have an acute reaction from that, and that can lead to PTSD after that. So then we have complex trauma. This is a result of prolonged exposure to a traumatic circumstance, such as like childhood abuse or childhood neglect, right? Because it's like that onion effect, it just adds on and on. And the effects of these complex traumas can be profound, and they include such a wide range of mental and physical health issues because the abuse is so deep. So we can have depression, anxiety, chronic pain, eating disorders. I mean, there's a huge aspect of complex trauma. So then we have the third one is developmental trauma. So this trauma occurs when the child's basic needs for safety, stability, and nurturing are not met, right? Those are like the very three components that happen when we're growing up. So this could be from neglect, abuse, or exposure to violence, whether that means the child was exposed personally or they witnessed it in their own family or some other type of violence. And developmental trauma can have a lasting effect, of course, on a child's development and can lead to a lot of mental health issues in adulthood. And the next one is interpersonal trauma. So this occurs when a person experiences a traumatic event that involves another person, such as sexual assault, domestic violence, or bullying, right? We see that a lot in schools and on social media. Interpersonal trauma can lead to a wide variety of both physical and mental health issues and emotional, and it can be particularly difficult to overcome because of the close relationship between the survivor and the perpetrator. Okay, so that's a big one there. And then collective trauma. So this is the last one is a result of traumatic event that affects the entire community. COVID, that's an easy one for us to relate to, such as a natural disaster, mass shooting, or war, the health of the entire planet. Collective trauma can have a profound impact on the mental and physical well-being of an entire community, right? And it can take a long time for individuals and communities to recover. So that's really interesting, right? We can see all these different pieces of how we can have trauma in our life and then how it affects us. And let's see. Oh yeah, it looks like Deanna was responding here. It looks like Andrea wrote head injuries. Yes. So we can have a lot of different pieces of how our body, one, feels that specific trauma, and then how we respond to it, whether it's an acute, complex, interpersonal, collective, etc. Okay, and again, it's important to note that everyone responds differently, and there is no one size fits all approach to healing. Some may experience some or all of the types of traumas that I listed, right? You could resonate with one, or you could be like, well, I've really experienced all of those. I myself have experienced at least 3 of those right off the bat. So it's like trauma is a place where I can identify personally, and I help my patients with all the time. Okay, let's talk. The next section is going to be trauma triggers. Now, this is a big piece. So what are some common triggers? What are common trauma triggers you've come across? So what are some common things that you experience, or they are either affecting you, or you can just say something that's affecting individuals in their daily life? Can you both put some things out there that what are some common trauma triggers you have come across? Anything that you can relate to or you just notice? I can think of some really important ones, like let's say for instance, a car accident. You could be, I had one in January, and triggers could be, somebody driving too close to me, or driving really fast by me, or swerving into a lane, right? I found I'm a little bit better now, but I was really easily triggered in the beginning, right? From that acute. So we can have lots of things. It can be, another thing could be, when I was at the Veterans Healing Farm, we had a workshop one time, and there was people across the street who were firing some guns, and the veterans, we had 3 women, I think it was, or maybe 1 man and 2 women anyway, who were really triggered by the gunshots, right? So it can be all kinds of things when we're in that PTSD moment that triggers us. And Andrea said, yeah, food. So getting sick when you eat and taste foods moment. Yes. So that's totally a trauma trigger. And then Deanna wrote someone yelling or a loud sound. Exactly. Like a specific truth. So a sound can be a trigger. A smell can be a trigger. Something that we taste can be a trigger, right? Something that touches us can be a trigger, or something that we touch, right? There's so many triggers that we experience. And being aware of those triggers is kind of the key component. So let's look at here at this next screen. This is a really good one I want to share. So this is how we are then experience the triggers of trauma, or what those triggers are. So we can have a reminder of the traumatic event, right? So we can, as I mentioned, see it, hear it, or smell it. That remind anything we smell, hear, or taste, see, it can remind us of the person or the traumatic event. And then that triggers the feelings. A lot of times that is anxiety or a panic attack. Those are pretty common feelings, right? Rapid heart rate, increase in blood pressure, sweating, right? You're in that fight or flight response. Anniversaries of the traumatic event, right? So 9/11 is a great example of that, because that was that we still have memories of that within our culture or in the United States. And that can be when anytime there is a date of a huge traumatic event, the anniversary can cause feelings of memories, feelings associated with the event that can make it challenging to cope with. Exposure to a similar event. So seeing or hearing about other traumatic events that are similar to the one that you've experienced, right? This can trigger that distress and trauma. So example, like watching the news about a similar natural disaster or something difficult that happened for someone on TV. That's why I personally don't watch TV or don't watch the news, is because of that. I don't need to watch trauma. Stressful big life changes. So such as moving, starting a new job, losing a loved one. These can trigger distress and trauma, because those are some of the major traumas that you can experience in a lifetime. Physical sensations, certain physical sensations such as loud noise, like Deanna mentioned, or bright light. These can really trigger that distress or trauma. And then emotions such as anger, fear, or guilt. These can really trigger the feelings of distress and trauma. So these are really huge, right? And these really show us how many different ways we can trigger, or we can be triggered by our outside environment, which then can signal our body to have the trauma response, that original trauma response that then kind of goes through in these waves through the system and through the body. And of course, it can be a physical, emotional, spiritual, mental aspect that our body feels from the trauma. Okay, so let's talk about how trauma then impacts the body. I know both of you have shared a couple of things, how it impacts the physical body. What are some things that trauma might affect the physical body that either we've talked about tonight, or that you've experienced in your own, or you just know about? Right. Upregulates cortisol, Deanna said. Yes, definitely. So our stress hormone is definitely triggered when it comes to trauma. And that's a huge component. So when we have cortisol upregulated, then it's downstream effect, right? We have chronic pain, we have weight gain, we have problems sleeping, we have anxiety. So there's lots of ways that cortisol affects us. Yes, that's a good one. Losing unplanned weight. Yes, that's a huge one when it comes to trauma. And it can be both things with trauma. It can be weight gain or weight loss, because we see your body is in this state of stress, right? So it doesn't understand how to deal with the trauma. So it just has a default, like, okay, I'm going to either go into my shell and kind of like, hide in my shell. Maybe that's losing weight or doesn't assimilate nutrients very well. Or maybe when you have stress and PTSD, maybe your tendency is to eat more comfort foods and gain weight. Okay, so the trauma, like we said, has significant impacts on the body, and the effects are both physical and emotional. And trauma can cause a wide range of physical symptoms. I mean, it's huge. Headaches, muscle tension, fatigue, stomach problems, changes in appetite, sleep pattern, sexual function, libido, hormonal changes. I mean, there's such a huge piece when it comes to trauma. It's really, I think a lot of those things I just mentioned have a lot to do with stress, right? And hormone dysfunction or hormone imbalance. So it's like the trauma, of course, is going to play a big aspect with stress. And it also, again, like I mentioned, affects the cardiovascular system. Remember, I said it changes blood pressure, heart rate, and that is because of the component we're seeing with the sympathetic nervous system, that fight or flight, really taking charge and coming into play. And again, it weakens that immune system, right? It makes us more susceptible to colds and flus, and especially as we're moving into quote unquote cold and flu season. So another piece is chronic pain. Back pain is very common, fibromyalgia, like I mentioned. And that is, again, because the stress hormone, cortisol, is causing an increase of inflammation in the body. And also we can see hormonal changes. We can see mood changes, energy changes with the adrenal system, and overall well-being. And trauma really also affects the brain. So we have brain fog. We can have memory changes, memory loss, attention, ADHD. We can have learning disabilities, right? So there's reading changes, cognitive function, cognitive ability changes. So we really see a big shift in the way that our brain works and the way that communicate with our loved ones. Of course, we can have a big shift there. Maybe in the work environment and family. It can extend outward more into our community, or even more global, right? How we communicate as a whole with each other on the planet. So it's important to note that the body's response to trauma, again, is complex and an individual, right? So you want to, I'm repeating this tonight because it's so important, that some people might experience different symptoms than others, especially severe physical symptoms, right? Because we all hold trauma in different ways in our body. And that's why it's good to release it through different types of physical care or emotional care, right? Whether that's talking things out, or getting different, like a spiritual reading, or getting a massage, or having acupuncture, or talking with a therapist, right? There's lots of different ways that we can work through and then manage the symptoms for our overall well-being. Okay, let's talk about some common conditions that show up because of trauma. And this is a huge one. And are either of you out there, anybody tuning in, aware of, I'm going to put this question up here. So, aware of any specific physical or mental health conditions that can manifest as a result of trauma? Or what have you maybe heard or experienced regarding the link between trauma and these conditions? So are there any specific conditions that either one of you out there have heard of, or are tuning in, if you're tuning in our post-webinar recording? Think about this question. Deanna said hypertension. Yes, that's a huge one. Great one. Hypertension or high blood pressure, right? And that change in our cardiovascular system. We can also see autoimmune diseases. We can see a lot of digestive problems, especially irritable bowel syndrome, and the chronic constipation and diarrhea. We see obesity because of the holding on of weight. There's so many different things. Like diabetes is also linked to not necessarily mental health, but physical health conditions as well. So many. That was a great one, Deanna. Hypertension, so key. So trauma leads to the development of a wide range of mental health disorders like we've been talking about. So one is PTSD. So that's post-traumatic stress disorder, and it has stress in the name, right? So we know, as I've been talking tonight, that stress is a huge component of trauma. So this is like the most common form, I think, because it's commonly used, the term. It is a severe anxiety disorder that can develop after a traumatic event, right? And that can be because of that, then a person can have flashbacks, nightmares, avoidance behaviors, feelings of guilt, shame, or anger. So all those components can come in with PTSD, very traumatic. And then the other one is depression. So depression, trauma can lead to feelings of sadness, hopelessness, and a loss of interest in activity. So that's a huge one. And that goes a lot in hand with chronic disease, because PTSD, sometimes the trauma can activate the chronic disease, but sometimes the chronic disease can be the trauma, right? And then the trauma can be the depression. The depression can activate. So there's like this triangle, and we're always experiencing in the relationship of trauma, depression, and chronic disease state. Really important. The next one is anxiety disorders. So trauma can lead to the development of anxiety disorders, such as generalized anxiety disorder, phobias. So phobias are different things like water, sounds, bugs, snakes. I mean, there's so many that can lead to trauma, a phobia. And panic disorders, having an anxiety attack or a panic disorder. These disorders make it difficult for a person to want to leave the house, right? Difficult to leave home or participate in specific activities where they're triggered by these traumas. The next one is substance abuse, right? This is a very common one, like the opioid epidemic is a great example. So trauma leads to the development of a substance abuse problem. That can be alcohol or drugs to help someone deal with the emotional pain of the trauma. So that's the emotional component, really. I do see, like opioids, I mentioned, patients turning to substance abuse with chronic, like physical conditions too, but a lot of times we see it with the substance abuse of the emotional trauma. Eating disorders. So this can be anorexia, bulimia, or binge eating, right, is a way to deal with a trauma, whether that's, like I mentioned earlier, bullying, right? As someone could be bullied for their weight and would either binge eat or sometimes even eat different amounts of food, or eat in hiding, right, to try to compensate for the trauma. The last one is borderline personality disorder. So trauma can also lead to intense emotional instability, impulsive behaviors, and intense unstable relationships, right? So we're getting to the extremes of how we can see trauma then relate through our life with a different way that it plays out. So again, not everyone is going to respond emotionally with the same specific symptoms. So a combination therapy might be, or is, very individualized. That could be supplements, diet, lifestyle, specific towards you and helping you deal with the trauma. Okay, the next section is emotions that develop, right? And so I talked a little bit about that component. And when we see, what are some of the emotions that we can see what are some of these emotional behaviors you've either observed or encountered yourself or others who have experienced trauma? If you could put that into the chat. What are some of the emotional components that you've either experienced yourself or seen in someone else or in your daily life when they have experienced trauma? Despair. Yeah, that's a great one, Deanna. Yeah. Despair, hopelessness, right? Really not knowing how to deal with the trauma or understand the trauma, how to process the trauma, get through the trauma, right? That's totally a great one, that despair. And I think that's really high, right? That goes hand in hand with the depression piece. Okay, so trauma leads to a wide variety of emotional, or not variety, but range is a better word, of emotional behaviors. And so we can see anger, resentment, and frustration, right? Directed either at ourselves or others or the world in general. Like, I'm so mad at that person. How could they do that to me, right? And a traumatized individual may also experience the need to feel like they need to constantly please one around them, the people pleaser, because they get in this worry that someone won't like them mode, right? The people pleaser mode, getting constant validation or approval, always saying yes, regardless of what it does for their own life and lifestyle, right? Oh, I'm just going to say yes because it doesn't matter to me, right? I don't want to hurt their feelings. I'm just going to say yes. I'm going to be the victim or martyr in this role, right? So trauma can also lead to lots of feelings of guilt and shame, like I was just saying, and particularly if the person feels that they could have done something to prevent the trauma, right? So they feel that shame in their own life and maybe with others in their life. A lot of times it'll lead to a withdrawal from the environment, and also avoiding any social interactions as a way it might trigger that particular circumstance or trigger their emotions. It can also lead to imposter syndrome, because this is when the individual doubts their own talents or skills, and they have this internalized fear of being exposed as a fraud, right? So that's a huge one with the imposter syndrome. And traumatized people may also experience a sense of emotional numbness. It's like this, they get numbed down, right? They don't want to have experience any emotion because it's so difficult to process the emotions, positive emotions as a way to connect with others, and negative emotions. So it's just like this negative kind of like total numbness. I'll choose not to experience anything because I might get hurt again, right? And that's a huge component of trauma. Especially I see that a lot with patients that have experienced a lot of grief and loss, right? It's like, they don't want to experience that grief again. So they just put themselves tighter and tighter into a place of non-expression and non-feeling because they don't want to experience that pain again. So then in contrast to that numbness, trauma can cause a person to be constantly on guard, like, oh my gosh, what's going to happen over there? Oh my gosh, what's going to happen over there, right? Leading to feelings of anxiety and irritability and difficulty concentrating. Like I mentioned, brain fog, memory loss, hard to work at your job, lead to emotional outbursts is very common, crying, yelling, breaking things, trying to deal with the emotions. So both sides of that are normal, right? Withdrawing inward and also expressing outward. Those are very common, or overexpressing in both of those things. Okay, so next part I'm going to talk about is the beginning of kind of so we have lay the groundwork with what's trauma, the physical aspect of how it affects our physical body, the emotional piece, and now we want to really talk about how the body is affected, simple steps to begin the recovery process about how the body is affected from trauma. Okay, I'm going to share this screen here because this is an important one. Okay, so this is kind of like the laying the ground rules for the recovery. So one, we want to really acknowledge and validate our feelings. So it's really important to be able to speak, right? And I talk a lot about that, speaking the truth from the thyroid gland, being able to speak your feelings, and then being validated that the feelings that you're experiencing are a result of the trauma. So that's key piece. So number one, acknowledge and validate your feelings. Number two is seeking professional help, which I've talked about, whether that's through me or a therapist is great, someone that can really dive deep into helping you process those feelings and develop coping strategies. Number three, self-care, huge, right? Is eating well, eating a healthy diet, sleep, water, exercise, community, love, emotional well-being, right? Practicing that self-care. Number four is connecting with others in your environment, in your own community, or maybe that's through a group setting, whether that's here in our group or some kind of other online meetup group or online forum. Do be careful with online forums and that you're not in one. I have had patients who will join online groups, and then what happens is it's kind of a like a complaining session. And so make sure you're in one that's not dragging you down emotionally, but that's uplifting you. Okay, learn relaxation techniques. So deep breathing, meditation, yoga. These are great for reducing stress and anxiety. You guys know that I love relaxation techniques as a way to help you to move through different traumas. Create a safety plan. So if you're very triggered, you want to make sure that you have a safety plan in place in case those triggers are overwhelming, and what can you do, right? You don't want to create like an escape plan, but you want to know what those triggers are, how you're going to respond, and have a safety plan in place. And again, taking one day at a time. Recovery from trauma is a process, and it's important to take it one day at a time. You can't rush the recovery, right? You definitely can't. #rush recovery. Okay, so remember that healing from trauma is a process, and it's important above all to be very patient with yourself, right? To be very patient and to know that it's going to be this long process as you're moving through things, and to be aware and be very gentle with yourself as you're moving through the trauma, and communicating well with those around you, whether if you're feeling comfortable, like, hey, I'm working through the trauma of this particular thing, this particular event, and I'd love for you to help support me and give me space, right, to be able to process it. That's an important part of the communication aspect. So I want to talk a little bit about the piece I mentioned in the beginning for those of you who have a loved one suffering from trauma, right? So caring for and supporting a loved one suffering from trauma can be just as challenging for you to work, right? Because you're going to have triggers. They're going to have needs that are triggered. There's going to be potential outbursts and drastic changes in behavior. So you need to be aware, if you have someone that's experiencing trauma in your own environment, that there are going to be things that are being triggering them, and be very aware what those triggers are. And so a trauma-informed care is a holistic approach to understanding and addressing the impact of trauma on yourself, as an individual, also your family environment, and in your community environment. And this approach will recognize that trauma is widespread, right? It's not just like, it's just not in our backyard, our yard. It's very widespread within our communities. And we want to make sure that we're prepared for how to deal with those suffering from trauma. So a few things here I want to share again here. Okay, so we want to have safety, really important to have safety. So trauma-informed care provides, like I mentioned, prioritizing this safe environment for yourself and for others, right? So you feel safe, right? That's that fight or flight aspect. So you're not re-traumatized over and over again. Trustworthy. So trauma-informed care emphasizes building trust between yourself and the provider, or self and the individual, like a family member, self and a practitioner, family trustworthiness, right? And if that has been broken with trauma, you need to try to see if you can rebuild that trust, right? Choice. So trauma-informed care empowers individuals to make choices about their care. This is very important. So going about the pace that is good for them, the direction of their treatment, and allowing them to kind of steer the boat, right? Collaboration. This is a huge one. So trauma-informed care requires collaboration with providers, organizations, community members, as a way to understand that the piece of collaboration gives the best care. So that's true with those of you that are tuning in tonight and watching it later, right? That collaborative care. I'm a big component of collaboration. And then empowerment, right? Empowering you to develop the skills and resources to manage your trauma. So that way it's not something that you just put on the shelf, right? It's not just a book that you can go up and pull down every once in a while. You really want to deal with the trauma and not just have it be in the back pocket anymore, but something that's on the front shelf, right? That you can recognize it, have the tools to deal with it, and then be able to process it. So education is a really important component, right? So the kind of care is important in various different settings. So we'll see healthcare settings, educational settings, criminal justice settings, social services, and more, where trauma is that key component, right? So whether maybe you've even worked in a specific healthcare environment, or you work in a healthcare environment where trauma is a key factor for those around you, knowing how to support those in that holistic environment, like myself, right? Like I'm a healthcare provider and I've had training in how to help patients manage trauma and also how to deal with that post myself, right? Processing the trauma of helping the person like, okay, that was really intense. What I need to, purge that from myself so I don't think about it myself. And that I can then really be there in the present moment and help someone, right? So you want to create compassion and an effective system to help yourself and families, community members deal with that. And it's essential that you to understand that trauma-informed care is not like a single event, right? Or a single program. It's very comprehensive, right? It's that collaboration, it's commitment, it's adaptation to things around you, it's organization. And so you really want to think about whether it's you experiencing the trauma or someone that what's the role that you can help forward in helping deal with that trauma, right? So trauma and from the emotional and the physiological response can be very distressing, right? As a one event or a series of events. It can take many, many forms, like I've talked about tonight. And the type of trauma or that you can experience can have a significant impact on your mental and physical well-being, right? So trauma can lead to, as we talked about tonight, we'll be talking more in next month and the month after, depression, anxiety, PTSD, and chronic pain. And again, it's a difficult and challenging process in the recovery, right? I'm a great example. I had my car accident in January, and I went through like 6 months of different therapy, seeing acupuncture. I didn't do any specific counseling, but I did do some work with my mentor, and then also doing a lot of emotional work, releasing it. And then also I had acupuncture and chiropractic work for my physical body, right? So I did a lot of work to help my body process it because I was in such great physical and emotional health, and I saw a huge shift, right? I was like, okay, this is a big component. I need to address it in lots of different ways. So you want to be proactive, know that it's difficult and can be challenging, and then make a plan for how you're going to work for overcoming it. And then just one day at a time, right? Create that safety plan with how you're going to deal with it. And remember that to be very, very patient. And if the symptoms progress or the symptoms worsen, then you really want to be proactive and seek professional help. And remember that it's never too late to start on any type of path from to recovery from trauma, because it ingrains within the body, right? The physical and the emotional body. So it's in there. So it's never too late to work on it, to help it move through the body and release. Okay. I have a meditation that I made for us. I recorded it ahead of time because I thought it would be easier. So I'm going to get it up and playing. I think I have to get out of my head. Okay. Let me pull it up for you. And I also put this in, and you'll have a release in the portal every couple of days of new information. And so I put in this, I think it's in a couple of days, a copy of this for you to listen to again, if you'd like to listen to it. And I'll have another one next week as well. Okay, let's see. Where did I put it? Here we go.
Welcome to this guided meditation, cultivating a sense of agency to overcome.
Okay, I'm going to restart it, but can you guys give me the thumbs up if you could hear that? Okay, great. Let me start it over again. I'm going to stop my video. That way you can just concentrate on creating that. And okay, here we go.
Welcome to this guided meditation, cultivating a sense of agency to overcome trauma. Please find a posture that feels relaxed and alert. Take a nice deep breath in, filling your lungs and let it out through your mouth. Again, take 2 more nice deep breaths. Feel your feet firmly planted on the ground, grounded to the earth. Feel the nice grounding cord all the way to the center crystalline core of the earth. And then take a nice deep breath, bringing that energy and grounding energy up into your root chakra. Feeling grounded and supported. Now let's reflect on a time in your life when you felt really good about having attained a goal. What goal do you feel really proud of? What choices and actions did you make? What were some of the little things that led up to it? Consider how you've added value in situations or to other people. And now reflect on some things that you get done over the course of a day. Recall ways you influence others or played a leadership role, perhaps in the family, friendship, or business. Bring mindfulness to some of the positive choices you've made, all empowering experiences that lead to a greater feeling of accomplishment or agency. See if you can open to this feeling. Let it fill you. Let it fill every cell of your being, every last drop. Help it last and allow it to become more intense in your mind, your heart, and your body. You have made things happen. You are competent. You are effective, and you will continue to be so. Bring mindfulness to any other feelings that may arise, like dignity, self-respect, or a sense of possibility. If you happen to feel any resistance to the sense of success or worth right now, that's okay. And completely normal. See if you can gently bring your mind back. Bring it back to your body, to remembering some of the good feelings after you did something that you're really proud of doing. Feel this sense of accomplishment or agency sink into the core of your being. And remember that you can tap into this feeling anytime you remember it. You can also sense what it will be like to accomplish more. Even the little tasks of the day, when you feel satisfied with meeting your goals that contribute to your well-being and the well-being of others. Open yourself up to the reality that you can build on a foundation of what you've already done. Let the ease spread through your body and mind and release any pressure or dryness. If there's a sense of fragility somewhere in your consciousness, it can be useful to imagine a nurturing person who's holding you as a child, as your little sweet self, reassuring you that you will reach your goals, that you're special and powerful, and that you can get things done and make a difference. Thank you for your courage to remember who you really are, for showing up, to bring mindfulness to the sense of agency that you have, and you have always had inside of you, ready to unleash at any time. Please remember, along with your trauma, there may be natural common feelings or beliefs of entrapment, immobilization, and helplessness. To some degree, you may not feel like you can escape the awfulness of it. Agency is just a fancy term for a feeling of being able to make things happen. To cultivate a sense of agency, remember a time when you felt accomplished or successful at having done something. Or pay attention to the little things that you do each day that make a difference to yourself and the people around you. A nice deep breath in. Connecting with the feeling of love for yourself and the sweet message. Feeling again rooted and grounded to the earth. When you're ready, take 3 nice deep breaths in. Rise and come back to the present. Thank you for joining us today for this meditation, cultivating a sense of agency to overcome.
Okay, how is that out there? How did you like that meditation? Looks like Andrea had to leave. She wasn't feeling well. Deanna, are you still there? I think you are. How was that meditation for you? It
It was good.
was good. Great.
Yeah.
Yeah, I put that, like I said, the recording of that. And that's just kind of like a beginning of our meditation for the program to really start like tuning in and connecting right to how that trauma feels. We don't want to go like super deep and intense in the beginning, right? Because we want to lay the groundwork for our body to recognize the trauma and then really help to release the trauma in our system. Okay, so that's all that I have for tonight. Do you have any questions or anything about anything that we discussed? Hmm.
No, I think that was good.
Okay, great. Well, I will put this video also in the program module, and let us know if you can't get in, okay? If you're not finding a way to find it in the portal system. Let me just see while you're on. I'm going to stop the recording here. And good night, everyone. Stay on for a minute, Deanna, so I can help you. Good night, everyone. Thank you for tuning in, and let me know if you have any follow-up questions.